So the last application we're going to talk about for electrical stim for pain management is iontophoresis, which uses direct current, of course. And then we're going to talk about some treatment considerations just overall for e-stim and some outcome measures that we might want to use for e-stim. So what type of current is used for transdermal drug delivery? And we know it's direct current, and we'll talk about the mechanism involved. The four variables that determine dosage of an iontophoresis applications and what can be adjusted, and indications, contraindications, and precautions specific to iontophoresis. So all of the contraindications and precautions for electrical stim also apply to ionto, but there's some specific ones just for ionto. So iontophoresis uses low amplitude direct current to facilitate transdermal drug delivery based on the principle that like charges repel. And it's most commonly used in rehabilitation to apply dexamethasone, which is an anti-inflammatory corticosteroid. It has a negative charge. And I've looked it up enough times. Sometimes it goes you go a long time before doing Ionto, and so I was always looking up what's the charge on Dex because if you don't get the chart, you don't put it on the right electrode, it's not going to work. So the drug penetrates a few millimeters into the tissue. So you want to keep that in mind when you're deciding where you're applying it. Usually the medication is prescribed by the doctor, and either it's prescribed by the doctor and the patient goes and picks it up and brings it in with them, or if you work in an inpatient facility or hospital system, it's usually delivered through the pharmacy department of that system, and then you apply it in physical therapy. So the variables that can be adjusted, the dose is almost always the same. For dexamethasone, it's 40 milliamps per minute. So you can adjust the amplitude based on what the patient can tolerate and the treatment time. Those are the two things you can adjust. So the amount of medication that you put onto the electrode is usually the same, and the dosage is usually the same. And what you're adjusting are the amplitude and the treatment time. So the amount of amplitude that the patient can tolerate determines the treatment time. So if the patient can only tolerate 1 milliamp, and direct current feels a little bit different from alternating current or pulsed current. So if they can only tolerate 1 milliamp, you're sitting there for 40 minutes of doing this. Unless you use a 24-hour Ionto patch, but we'll talk about those. So if they can tolerate 2 milliamps, then the treatment time is 20 minutes. If they can top, well, I'm not going to read the chart to you. You can read the rest. So it would be great if everybody could tolerate 4 milliamps and the treatment time would just be 10 minutes. But that it just depends on what they can tolerate. So, and sometimes it's different parts of the body, and parts of the body that are more sensitive, you might not be able to tolerate the higher amplitude, and it might take longer. I did iontophoresis on somebody's plantar fasciitis at one time, and they could only tolerate 1 milliamp because it was so sensitive, and so it took 40 minutes. So there's low voltage iontophoresis. There are 24-hour patches, like is shown on the person's arm there. You apply the medication and then you put the patch on. It's almost like a Band-Aid, except it has the little electrical cell in it. And then they leave it on for 24 hours and then they take it off. There are also these little hybrid devices, which is that photo in the middle, and it's basically preset amplitude and you just turn it on and leave it on. Or you can do the one with the two separate electrodes. So electrode placement and size, you want the active electrode. So with dexamethasone, it's negatively charged. So you apply dexamethasone to the negative electrode and saline to the positive electrode. And you put the negative electrode over the area of inflammation. So like say it's epicondylitis, you want that negative electrode right on their epicondyle. You want to choose the electrode size so the current density does not exceed 0.5 milliamps per centimeter squared. And most Ionto electrodes are the same size. You don't have a lot of choice in electrodes. And make sure your polarity is the same as the active ion in the drug. So that's their, other than just a few little parameters, it's pretty easy application. So standard contraindications and precautions for all electrical stim apply to Ionto as well, but additional contraindications and precautions, it shouldn't be applied right after the application of physical agents that can alter skin permeability, like heat, ice, or ultrasound. So when you're planning your treatment, if Ionto is involved, you want to make sure that those other modalities are not involved. And you need to pay attention to contraindications for the drug. Most of the time we're using dexamethasone, but there are some other drugs that are occasionally used for iontophoresis. So make sure that you know what the contraindications for those are as well. So once you've applied the ultrasound, you want functional outcome measures, not ultrasound, electrical stim or ultrasound, but you want functional outcome measures that apply, they assess pain during activities compared to pain at rest. So it's not just a passive treatment. You have to make sure that you are improving people's function as well. So applying doing like timed up and go, 6-minute walk test, improvement in patients with post-operative pain, or function in patients with fibromyalgia. There are some different outcome measures that you can use for those specific instances. So the whole idea is we want to improve people's function. It's not just about doing passive treatments. So you want to assess the outcomes at the time of the expected optimal effects. So when you're using high rate TENS, you want to assess the outcome while the TENS is activated or immediately and shortly post-treatment. You also want to assess outcomes after a short-term bout of treatment, after about a month of usage, if you're doing it 2 times a week. And also, if you have the opportunity to assess outcomes long-term after 6 months with or without treatment. So really, ideally, you want to assess either while you have the TENS on or immediately afterwards. And then short-term, and if you have the ability to do it long-term, just to see if it's having some long-term effects. So just a summary, what you're going to do for any electrical stim treatment, you're going to select the appropriate client, make sure that that treatment is appropriate for them, and identify the indications that you are treating with the e-stim. You want to consider contraindications and make the adjustments you need to do for individual precautions. You want to educate the client about the procedure and how you're going to integrate it into the plan of care. You want to establish active functional outcome measures related to electrical stim treatment and do pre-treatment assessments as well as post-treatment assessments. You want to prepare their skin for treatment. So you're either going to cleanse the skin, make sure there are no oils or lotions or anything on the skin, and clip hair as needed. So if people are very hairy, the electrodes aren't going to stick to them. So you might need to clip hair. You want to select and apply the electrodes and record where you placed them, write that in your chart. You want to select your stimulus mode, considering pain medications, and select the mode accordingly. So probably with pain medications, you're going to do a sensory level treatment, and without, you can do sensory or motor. You want to adjust the frequency and the pulse duration. You want to advance the amplitude for each channel separately or permit the client to advance the amplitude. And that gives them some control over the treatment, which is appreciated usually. You want to adjust the stimulation to strong but tolerable sensory stimulus or at the motor threshold, depending whether you're doing a sensory or a motor application. You want to monitor their response during the treatment. You want to adjust for habituation by increasing the amplitude to achieve adequate dose response relationship. And so during and after the treatment, you want to treat for at least 30 minutes initially, monitoring their response, including pain intensity at rest, vital signs, posture, response to activities, or whether or not the treatment evokes pain. If you're doing TENS or IFC, the patient may participate in activity during the treatment, but you want to be careful not to cause injury if the pain response is being masked by electrical stim. So whether you're doing manual therapy or end ranges of motion, sometimes you can apply a TENS unit while someone is doing exercise to moderate pain during their exercise. Following the treatment, you want to remove the electrodes, inspect the skin, note any skin irritation if there is any. Tell the patient what to do if there is any skin irritation. You want to reassess pain and functional participation responses. So pre-treatment, during treatment, and immediately post-treatment. And also, I like to tell people, take note of how you feel later today, and then tell me the next time you come in. So we can kind of get that little bit longer term assessment. Post-treatment, you can have the client maintain an activity log to assess functional outcomes over time. You can adjust parameters or electrode placements during treatment. But once you get it adjusted right, they should be left intact for a long enough time to be able to evaluate the effectiveness. And then their home program might include time-dependent rather than pain-dependent use of TENS. So say you're going to use it for a certain amount of time each day, especially for patients who have chronic pain. It's better to do a time-dependent rather than, because pain dependent, a lot of people with chronic pain just have pain all the time. And so you want to design a home program for them that is going to take that into account. And you have just survived your last eSTIM lecture.